Pessaries can be a useful addition to women's health, remembering that the mucous membrane in the vagina shares the same properties and general background terrain as the mucous membranes in the nose, throat, digestive tract, all the way down to the back passage. We want local actions which will help the terrain, the background flora and health of the mucous membranes. The ones we commonly use are marigold pessaries, used with either the marigold herb or a fixed oil, which is an extract of the whole herb in a fixed oil. And the properties that we're looking for are healing action, general moisturizing, antifungal, antibacterial, antioxidant, and antiseptic properties. The marigold pessaries are particularly helpful for women after the menopause if there is dryness, poor function of the mucous membrane, often secondary to a change in the microbiome, which is the vaginal flora, the same way as we think about the gut flora. There's a normal vaginal flora. Lavender essential oil is anti-inflammatory and antiseptic, and tea tree essential oil is primarily antifungal, although it does have other actions. We have two kinds of pessaries, the marigold pessaries, and then a combination of lavender essential oil and tea tree essential oil pessaries combined together. The overall emphasis for both of these is a healthy microbiome or vaginal flora. These can be used according to the individual patient's needs. If a woman over the age of the menopause wants moisturizing, soothing mucous membrane support, she may want to use a vaginal pessary once a week or twice a week. She may want to use a pessary 6 nights in a row and then use them once or twice a week just for comfort. The lavender and essential oil and the tea tree essential oil is often used in combination with prescribed antibiotics in order to avert thrush, and can also be used cyclically for 2 or 3 days before the period if there is a recurring problem with thrush. But really, people can titrate the use of these in order to manage their own ongoing recurrent symptoms. Usually, if there's a problem with the vaginal microbiome, these should be accompanied with probiotics or a mixture of probiotics and prebiotics orally, and at the very least, natural live yogurt once a day. So they're really used for managing chronic ongoing dysfunction of the vaginal microflora in ways that mean that the person is uncomfortable, and they can use these according to how they maintain their own comfort levels. So use regularly for recurring symptoms, accompany with probiotics, and change lifestyle, which primarily means reducing sugar in the diet, but also maintaining the essential fatty acids and all of the things according to the three-legged stool. Following on the theme of hormone balance, and particularly postmenopausal, but all through the lifespan, we want to make sure that we have enough bone strengtheners to keep our skeleton in good, thriving condition. Remember, even bone has a turnover of all of its cells every 7 years. Particularly important for girls to women between the ages of the onset of the menstrual cycle up until between 21 and 25, that they have good mineralizing balance to their diet, because it's during these ages that young women lay down the calcium strength of their bones, and it's from that plateau that the bone minerals can be lost after the menopause. So this is obviously an age where they're often eating sugars and not paying attention to their diet because they're young and don't feel the effects of a poor diet. So it's very important to get these nutrients into them, and if they won't eat them as food, to give them a calcium supplement. If we're looking to strengthen the bone, what actions are we looking for? We're looking obviously for a high mineral content. We're also looking for an alterative effect, so that the background terrain isn't holding on to too many toxins or substances that's not normal for them to be there. You want good elimination. Anti-inflammatory effect, because above all else, thinning of the bone from a herbal point of view comes from an inflammatory background, causing leaching of the minerals from the bone in order to protect the blood composition. Hormone balancing, because obviously it's after the menopause in particular that bone strength can be lost, and that's due to the relative reduction of estrogen hormones. As we said before, we want to promote bile flow because bile is an important regulator of the elimination patterns of breakdown products of hormone balance. Liver function is also important. Having a good hepatic enzyme function is important for the hormone levels and the relative hormone levels in the blood, and particularly in relation to neurotransmitters and the interaction between those and circulating hormones. These are the actions that we're looking for. What we can't say is that we have research evidence of thousands of patients who have been in research trials to show that these make a clinically significant or a statistically significant difference in clinical trials. So these are part of a general strategy for keeping healthy with this good profile of healthy balance. Let's look at the action of the herbs in the bone building tea. First of all, we have Boneset, and this is a fever lowering, sweat supporting, bone healing for fractures. It helps eliminate toxins. It has a bitter tonic effect and an immune tonic effect. Marshmallow root is rich in minerals, also soothing to the digestive tract and promotes digestive health. Horsetail, as we've said before, is also high in minerals and particularly silica. Yellow dock root has an alterative action, which is a gentle laxative effect and a bile stimulating effect. Alfalfa has nutrient roots which penetrate 25 meters and is rich in calcium, magnesium, and phosphorus in particular. Nettle leaf is rich in iron and other metals, and it also has an alterative effect. And dandelion leaf is a nutrient effect, particularly for vitamins. It also has an hepatic effect and is bile stimulating and an alterative by way of promoting urine flow. All in all, we're looking there at a tea which would be considered a detoxification tea with mineral rich herbs and also have an anti-inflammatory aspect to them. So you're looking at this being a very nice tea for preventing most degenerative conditions from a herbal medicine point of view. Above all else, of course, dandelion leaf is a diuretic. As such, it helps keep the blood clear of toxins, particularly those that are eliminated by the kidneys. I realised after talking about the bone building tea that this would actually be a good time to introduce the concept of encumbrance. When you look up a dictionary definition of encumbrance, it describes something that encumbers as something burdensome, useless, or superfluous. This is very relevant to how we see things as medical herbalists, because if you have a blood that has superfluous, useless metabolites that are not being eliminated properly, or when the body attempts to eliminate them, they're being reabsorbed back into the system, as with hormone breakdown products in the gut, if there isn't adequate bile and fiber to facilitate final elimination. We would describe that condition in the blood as pre-inflammatory. It's a condition of the matrix, and the matrix is the intracellular and extracellular fluid, and that is divided by the cell walls into what's inside the cell and what's outside the cell. What's outside the cell or between the cells is like a potential space. There's a glistening membrane, if you like, to consider it, around all of the cells, and they slide against each other. But between the two walls that are sliding, there is a potential space in which many of the chemical reactions that make up a living body take place. You can think of this as a suspending fluid. There's no pockets of fluid, there's no space, but there's a suspending fluid within which all of the cells are active. Each of the cells has an electrolyte balance, which creates electric charge, which gives a vibratory signature different from inside the cells to between the cells. And cells of different tissues have different vibrations and frequencies. Organs have particular vibrations and frequencies. Bodily fluids have particular frequencies and vibrations. And then your whole being has a total frequency and vibration. You can visualize this by considering how you feel when somebody is approaching you and they come closer and they come closer and you make eye contact and you come within a close physical space of the other person. And then there's a point whereby they cross a barrier of your physical awareness where you feel uncomfortable. And that's where the two vibratory energies actually meet. And that's what we mean when we, in an emotional sense, talk about our physical space and somebody is invading our space. And this is because each body has their own vibration and frequency. So, this is a way of picturing it. Within that vibration and frequency, the pH balance and the acid alkaline balance plays a role because these are part of the electricity system. They determine the electricity gaps between the inside of a cell and the outside of a cell and the organization of different tissues. Encumbrance is when this isn't flowing well and it interferes with the frequency and the vibration. Now, this is a very conceptual way of looking at it, but many of these concepts are actually based in what we understand of cell chemistry, electrolyte balance, and physiology. And this is why a lot of the actions of the herbs actually make sense from a herbal action point of view and from a medicinal and healing therapeutic view. I hope you enjoy looking at bodies and tissues and cells in a way that is in keeping with the energies of the herbs, as well as the chemical constituents and the research. They're just like little pockets of information. They're very nice little pockets of information, but the totality of the herbs is based on an energy medicine, where the energy of the herbs is contributing to your vital force, as is all the food that you eat and the exercise that you do. They're all considered together in this holistic way. This illustration gives the best description of what I'm talking about. That in our lives we laugh, we cry, we'll dance, we'll sweat, and we'll be involved in our lives in a very invigorating way and in a very emotional way. I think this slide spoke to me a lot because I don't know how many patients who come in and apologize for their emotions as though there's something that's divorced from them or something that they feel should be kept down and not attributed any energy. But of course, it's our emotional energy that very much reflects what's happening in our physiology and our chemistry. So I hope you'll enjoy lots of laughing, crying, sweating, and dancing as part of staying well and keeping vibrant.